111E and a student nurse from Davao Doctors College. Today, I will be performing my return demonstration about assessing the abdomen. So, assessment of the abdomen consists of inspection, auscultation, percussion, and palpation. So, prior to the conduct of the procedure, we need to review the client's previous medical records and doctor's order sheet if available, because we need this to know the past health record of our client. Next, determine the scope of assessment needed. Prepare necessary equipment such as tape measure. This tape measure, we need this tape measure to measure the patient abdominal girth, a ruler for the hypersensitivity test, and of course a stethoscope to listen for patient's bowel sounds. And also, complete equipment will help us to conserve time and energy. And also, now perform hand hygiene to protect yourself and a client from any spread of pathogenic microorganisms. Good day, sir. I am Katrin Kimagibon from Davao Doctors College and also your student nurse for today. May I see your hand, please? Can you please state your complete name?
Andres.
How about your birth date? Okay. So, how would you like me to call you?
Sir,
Okay, sir. So, today, sir, I'll be assessing your abdomen because it is the key step in the evaluation of abdominal complaints such as pain, distension, enlarged organs, or masses. So, now, I will close the door so that no one from the outside will disturb us during the whole assessment, and also, I will fix the curtains. So, sir, are you comfortable with the room temperature? I already adjusted.
Yes.
Thank you. So, before we start, sir, I would like to ask if you eat anything before the assessment.
No.
Alright. So, now, a full bladder can make the examination uncomfortable, and it can reduce the accuracy of the bundle height measurement. So now, for the surveying of the abdomen, the first thing to do is to position the client in a supine position. It can help to ensure relaxation of the patient's abdomen. Okay, sir, you can now do a supine position. And now, next, cover the upper and lower body parts with a bed sheet, leaving the abdomen exposed. This promotes privacy to our client. Okay, sir, may I ask you a permission to take off your shirts?
Sure.
And now, observe the abdominal skin and note for any vascularities like visible dilated veins or spider veins. Also note any stretch marks in the client's abdomen. Okay. And now, assess also for scars, lesions, and rashes. If there is any if there is any, it is important to note the history of scars and document its location by quadrant and reference lines. Okay. Now, inspect the umbilical location for color, contour, and location. This is to know if there are any abnormalities within the umbilical region. Now, observe for abdominal contour and symmetry while the client lies flat or supine on the bed. Sitting beside the client and look across the abdomen at a level slightly higher than the client's abdomen. Also, inspect the area in between the lower ribs and pubic bone and note for any abdominal enlargement. Now, ensure that the client has emptied his or her bladder. This is to eliminate bladder extension and interference with an accurate examination. Okay, sir, may I ask if you urinated before the assessment?
Yes, I already urinated.
Alright. So, now position the client in a standing or in a supine position. Client's head may be slightly elevated for orthopneic patients to avoid putting additional pressure over the abdomen. And also, place the tape measure behind the client and measure starting on the umbilicus. Then, record the distance on the designated unit. Take all future measurements from the same location, especially for noted distension. Sir, I'll start measuring your abdominal girth. Okay, may I, Thank you. And now, mark the abdomen with ballpoint pen to aid in measuring site and ask the client not to wash the mark until it's no longer needed. Okay, sir, you can you please not erase the mark that I put your abdomen because I might need it later. Okay, so now, sir, may I ask you to please raise your head for me to further assess for herniation or diastasis. For normal findings, the abdomen should not bulge when the client raises head. Okay. And now, also inspect the abdominal movement when the client's breaths. Abdominal respiratory movement may be seen especially in male patients. And also now, observe for peristaltic waves. Normally, peristaltic waves are not seen, although they may be visible in very thin people as light ripples in the abdominal wall. Now, proceeding to auscultation of the patient's bowel sounds, I will be using the diaphragm of my stethoscope and listening to the bowel sounds of my patient. It is also important to make sure that it is warm before placing it on the abdomen to avoid startling the client of the coldness of the stethoscope. We need to only apply light pressure or supply rest the stethoscope if the abdomen is tender or painful. Then listen to each quadrant for 1 minute. An easy way to remember it is to equate one vowel sounds to one breath sound. Also, we need to note the intensity, pitch, and frequency of the sound. And now, listen for vascular sounds. Use the bell of the stethoscope to listen for bruits over the abdominal aorta, radial, iliac, and femoral arteries. And now, auscultate for venous, hum, and epigastric and umbilical areas using the bell of the stethoscope. And now, auscultate for friction rub over the liver and spleen by placing the diaphragm of the stethoscope over the right and left lower rib cage and listen for friction rub. Proceeding now to percussion of the patient's abdomen. With the percussion head technique, lightly and systematically percuss all quadrants. Percussion may proceed clockwise or up and down over the abdomen. And now percuss for the vertical liver span at the mid-clavicular line from the right lower quadrant along the mid-clavicular line. Percuss upwards towards the liver. Note the change from tympanid to dullness and mark the area of dullness. Proceeding now, assess the descent of the liver by locating the liver border of dullness. Now percuss and perform percussion and ask the client to exhale afterwards. Okay, sir, can you please take a deep breath? Okay, and now, I need to locate the upper right just at the mid-clavicular line and percuss downward. Mark the point where change from the upper right, chest or lung resonance until liver dullness is noted. This is the upper border of liver dullness, and now measure the distance between the two marks. This is the liver span, and repeat the percussion of the liver at the mid-sternal line. Okay, and now begin percussion on the posterior to the left mid-axillary line, or MAP, and percuss downward. Note the change from the lung resonance to splenic dullness, and also perform a second method of percussion to determine enlargement by asking the client to take a deep breath and start percussing on the left interspace at the anterior axillary line. Okay, sir, can you take a deep breath? Okay. So, now, and we need to percuss also the spleen. Okay, sir, can you please take a deep breath again? Okay, sir, may I ask you to please take a seat? Okay, then now place the left hand fist against the lower right anterior rib cage. Use the ulnar side of the right fist and strike the left hand, and note for any tenderness upon percussion. So, in the same time position, left the client seat, then place the left hand on the costovertebral angles, and repeat the exact same process from the first two steps of percussion of the spleen. Reposition the client in a supine position. Cover the upper and lower body parts with a bed sheet, leaving the abdomen exposed to give patients comfort and privacy. Okay, sir, you may lay down. Begin palpating on a non-tender abdominal quadrant. Use fingertips to compress the quadrant to a depth of 1 cm in a dipping motion. Lift fingers gently and proceed to next quadrant. And now begin palpating deeply all quadrants to delineate organs. Use the palmar surface of the fingers to compress quadrants to a maximum of depth of 5 to 6 cm. Note for any resistance or any deeper structures, and perform bimanual palpation if resistant or deeper structures is felt. And now palpate for masses and use fingertips to compress all quadrants to a depth of 1 cm in a dipping motion. Also note for any masses and its size, location, shape, consistency, demarcation, pulsatility, tenderness, and mobility. And also palpate the umbilicus and its surrounding, and note for any bulges and masses. For palpating the aorta, use your thumb and first finger, or use both hands to palpate deeply the aorta and also assess for pulsations. And now for palpating the liver, the first thing to do is stand at the client's right side. Place the left hand under the client's back at the level of the 11th and 12th ribs. Then lay right hand parallel to the right costal margin, or the fingertips should point toward the client's head. And also note for consistency and tenderness. And palpating by hooking, still stand at the client's right chest. Curl or hook the fingers of the both hands over the edge of the right costal margin. Note for consistency and tenderness. Kindly stand up, sir. And now, sir, can you please inhale and exhale? Again. Okay, you may now lay down. And now palpate the spleen by moving it downward and forward. Document the size in centimeters below the left costal margin and note for consistency and tenderness. And now we will proceed to the palpating the kidney first. Place the left hand on the right posterior flank and provide support. Now I will be placing my right hand on the right upper quadrant, just below the costal margin. Just below the costal margin at the mid-clavicular line, and ask the client to exhale and hold breathe briefly and gradually release the pressure of the right head and repeat steps for the left kidney. Sir, can you please inhale and hold? Now begin palpating at the symphysis pubis and move upward and outward to estimate bladder borders. And note for consistency and tenderness. And now test first. Psoas sign, ask the client to lie on the left side. Hyperextend the right leg at the client and note for pain and reaction of the client. Okay, sir, can you please do a sideline position? And I'm going to expose this part. And now, test for obturator sign. Hold and support the client's right knee and ankle. Flex the hip and knee and rotate the leg internally and externally. Note for pain and reaction of the client. Okay, sir, I'm going to expose this part again. Now, in testing the appendicitis, assess for rebound tenderness by palpating deeply at 90 degrees into the abdomen away from the painful or tender area. Suddenly release pressure, listen, and watch the client's expression of pain. abdomen? Okay, sir, which hurt more? When I press it or release it?
No, I don't feel any pain.
Okay, sir, can you tell me which area of the abdomen hurts?
I don't feel any pain.
Okay, thank you. So, help the client to put back his clothes on and position the client comfortable on bed. Okay, sir, can you please take your shirts again?
Can you please hold this?
Sure. Okay, now I'm going to summarize all the data I've gathered earlier. Okay, sir, now that we're done with the assessment of your abdomen, so far, for your inspection, your skin is uniform in color, no lesions, no rashes, and your umbilicus is midline and inverted, which is normal. And your abdomen is symmetrical, and upon auscultation of your bowel sounds while I was listening earlier to your abdomen, the sound is normal. No bruises or venous hump, and also while I was measuring for your liver side, on your liver span at the mid-sternal line, it is measured at 5 centimeters, which falls within the normal range. Okay, so upon percussion, sir, and palpation also, there were no tenderness, no bulges, no masses, and no swelling. And also overall, your abdomen is doing really good. So, but before I leave, I just want to give you some advice to keep your abdominal internal organs healthy. Is that okay with you? So, avoid drinking too much, sir, alcohol, and to keep your abdominal internal organs healthy, increase your fluid intake such as water to flush out unwanted residues on your liver, bladder, and your intestine. And is that okay with you?
Yes.
Okay. So, but before that, sir, I advise you to eat on time and avoid skipping your meals. So, also avoid eating big meals. But before you go to bed, and always make sure that you drink plenty of water every day. Okay, sir, do you have any questions or clarifications or concerns? Okay, so now that we're done, sir, thank you so much for your cooperation, sir, and rest assured that all the data I've gathered earlier will be kept confidential. And now I'm going to perform hand hygiene or hand washing. And now document findings in the client record using printed or electronic forms or checklists supplemented by narrative notes when appropriate. Thank you so much. That's all for today.